Good morning everyone, Dr. Rohit here. So I am basically trained in cataract and refractive surgery. So I did my MBBS from Bangalore and followed by MS through All India quota, Coimbatore Medical College. So I joined in the year 2012 and finished in 2015. Later DNB from the National Board and then fellowship in phaco-refractive surgeon from Netradama Super Speciality Hospital, followed by FICO UK. So before we start this class, I want to keep some things very clear. Okay, so you should know that the total number of MD/MS seats we have when we're giving NEET is around 44,000. Okay, so every year 44,000 seats is the only thing we have, out of which 36,000 is MD/MS. Remaining 8,000 is DNB seats. And how many people are applying for this seats out of the 44,000? So this year in 2022, the number of applicants was 2,01,000. Okay, out of which 1,82,000 had appeared for the NEET exam. What this simply means that out of 4 people giving the exam, only 1 candidate is qualifying. So the ratio is 1:4. So for every 4 candidates giving the exam, only 1 person is getting a seat. And again, in this, it is not necessary that the person is taking the seat of his choice. The number of people giving the exam and number of people getting the seat of choice is restricted to around 10% only. Okay, so that means out of the total 1,82,000 people, hardly 10% of them get the seat of their choice. So next, you have to remember is this is increased. Actually, when I gave the exam, the ratio was around 1:6. So for every 6 candidates, there was a single student getting a PGC. But now the ratio has, because of the increase in the number of seats which have been added, the ratio has come down. So for every 4 candidates giving the exam, 1 person is getting a seat. Okay, so in this number will keep on, the number of applicants year on year will only keep on increasing. Why? Because the remaining 3 students who have not got in the current year will take up the exam again and will want to take a seat again. So what is happening is there is an exponential increase in the number of applicants and number of people applying for the exam, while the total number of seats are not drastically increasing. Okay, so you have to be very serious about this, because your career, your future 20-30 years, what you're going to spend after this will be determined by which subject you take, which college you take, what specialty you take, how well you do in the specialty. Okay, so all your next 20-30 years of your life, your earnings, all will depend upon your these factors. Okay, so be a little more serious, and some preparation tips I want to tell. So this is how I prepared. So this may vary, but the standard this one is, see, whenever you're giving an exam, start with at least 10 to 12 months period. Okay, for reading and preparation, keep at least 10 to 12 month period. Okay, in this 10 to 12 month period, what you should do? So first you should take your core subjects. Which are the core subjects? Medicine, surgery, OBG, pediatrics, which have very high weightage. Okay, the total number of questions where there's high weightage, like anatomy, physiology, biochemistry. So first you have to divide the number of days for each of the core subjects. Okay, then you have to, so what should happen is, ideally you should keep around 2 weeks for anatomy, finish the whole portions, give the subject wise exam in anatomy, and next week onwards start with physiology. Okay, like that you should have set time, and you should keep a 1 month revision gap towards the end of your preparation. Okay, so this is how you are ideally supposed to prepare. Have like 4 or 5 core subjects as your strengths. Okay, so you should be very good in 4 or 5 core subjects. Along with that, your small subjects, you should also see. Again, what happens is, people, majority of them, either they concentrate too much on the short subjects, or either they concentrate too much on the core subjects. So there should be a uniform balance. So you should be good at your core subjects, but equally you should not neglect the short subjects, because short subjects, just if you see the current NEET 2022 in ophthalmology itself, we got around 12 questions. Okay, so out of the 200 questions, 12 questions is around 6%. Okay, so when there 6% weightage, even 1 or 2 questions will matter. Okay, so what happens out of the total 200 questions in NEET, total 200 questions, what happens? 50 to 60% of the topics are repeat topics. So what I mean by repeat topics, so what happens this time, for example, there was something about ROP. Okay, so next time also you can expect a question on ROP. Maybe they will not give the same question and the same options. They will modify the question slightly, but the topic will remain the same. Okay, so the repeat topic should be in your fingertips. So when you go back to prepare, first thing what you have to do is the last 5-year paper. Take your last